Brilliant. So morning, everyone. I'm delighted to see everyone on the call this morning. It's our third webinar of the year, and our previous webinars were done with Ronan Doherty and Joe O'Brien. So it's brilliant to see that our members are still finding value in these online webinars. So it's great, and it's something that we can hopefully continue going forward. So I just want to say a massive thank you to the National Dairy Council. They are kind sponsors of these webinars, and they allow us to deliver sessions such as today. So hopefully going forward, this is a relationship that we can continue and be able to provide more of these sessions, because there's definitely massive value in these sessions for our members. So just some housekeeping on the webinar this morning. We do have a survey that when the webinar ends, you'll be asked to fill in. I'd appreciate if you could take a few moments just to fill in this survey. So it will just provide us with some feedback around these webinars, and hopefully some future webinars you'd like to see, the kind of topics or speakers which you may like to see, and just some general feedback that we would like going forward. We also have a Q&A and a chat function, which I will monitor throughout the session. I know Maeve is happy to take any questions you have at the end, but definitely as we're going through the presentation, if anything crops up, certainly throw your question into the chat function or the Q&A function, and I'll be able to monitor it there and definitely bring those questions to Maeve. Also today, it'd be great if you could tag us, the National Dairy Council and Maeve, in any social media posts. I'll be able to throw the Twitter handles and the Instagram handles into the chat function. But if you are on the webinar this morning, we would appreciate you to take a screenshot or take a picture on your phone and put up an Instagram story or put up a Twitter post. So without any further ado, I'm delighted to introduce our guest today. So we're joined by Maeve Hanan. Maeve is a registered dietitian who has a range of experience in clinical nutrition and nutrition communication. So Maeve is passionate about helping people to improve their relationship with food in a compassionate and evidence-based and weight-inclusive way. So Maeve founded Dietetically Speaking in 2015, when she began to share nutrition messages online and on social media. As well as her work on social media, Maeve runs an online clinic and online courses for those who struggle with their relationship with food. So we're delighted to be joined by Maeve today to give us some practical advice regarding disordered eating. And I would definitely advise everyone to follow Maeve on Instagram and to check out her website, where she has some great blog posts. So Maeve, I will pass it over to you, and I will fade away into the background, but I'll be sure to keep an eye on the chat, okay? Thanks, Maeve.
Thank you so much, Dara, for that lovely introduction. And I'm really delighted to be here to talk to you all today about disordered eating. This is my specialist area. I'm so passionate about it. And I think it's so important to have this specific conversation with exercise professionals. So I'm not going to spend too much time on my background because Dara already did a lovely introduction. The one thing I will say, though, is people are often confused about where I'm based and things. So I am Irish, I'm from Bray. I studied to be a dietitian in Northern Ireland, and I started off my career in the UK, and then I've been sort of back and forth between the UK and Ireland, but I'm currently based and settled in the UK, working fully online though, so I work with clients in both the UK and Ireland as I'm registered in both countries. So what we're going to be looking at today then is, first of all, what is disordered eating? Just so we're really clear, what are we talking about here? Looking at some of the risks as well related to disordered eating, and also then who is at risk and specific red flags to look out for. So those red flags are going to be a real key feature of this talk. I thought it was really important as well then to cover safely responding to disordered eating as an exercise professional, and I hope you find that helpful. And then we also are going to cover some preventative measures. So that will include non-diet approaches and thinking about our language in particular. So just to highlight that this presentation, it's based on the general adult population. I will be touching on some specific at-risk groups, but the client group that I work with is adults. So that's really what we're talking about here. And I do try to keep this interactive, so I'll be keeping an eye on the chat box. As Dara said, I'll take most questions at the end, but feel free to pop those questions in the Q&A as they come up. And but it would be great though for the interactive parts, when I'm asking you questions, if you could type in your answer into the chat box. Okay. So starting off then with, what is disordered eating? So there isn't really one specific definition of what disordered eating is. And this is partially because we don't have diagnostic criteria for disordered eating in the same way that we do for an eating disorder. So I'm going to talk to you about what the difference is between those two things now in a moment. But just to say really that there isn't that one specific definition. Studies and research will sometimes use slightly different definitions. And it isn't like set out anywhere like in the DSM-5 or in the ICD-10 in the same way that the eating disorder criteria is. So the explanation of disordered eating that I quite like is from the National Eating Disorders Collaboration of Australia. So they describe disordered eating as sitting on a spectrum between normal eating and an eating disorder. Disordered eating may include symptoms and behaviours of eating disorders, but to a lesser frequency and to a lower severity. Disordered eating can include restrictive eating, compulsive eating, irregular or inflexible eating, and dieting is one of the most common forms of disordered eating. So one of the reasons that I really like that description of disordered eating is it talks about this spectrum of eating relationships. So when we talk about this, what we're looking at is, on the far left here, we have normal eating or what we might call a healthy relationship with food, all the way down to a clinical eating disorder on the opposite end of the spectrum. In between then we have dieting and subclinical eating disorder. So subclinical eating disorder would be equivalent really to disordered eating. And you can see that each of those areas there overlap with each other as well. And why I think this is so important is that people don't always fit neatly into boxes of, you have this diagnosis, you have this criteria, or maybe they do for a short period of time, but they move in and out of that diagnosis depending on what's going on for them. So I actually see disordered eating as a much more inclusive way of describing people who are struggling with their relationship with food. So that's anywhere from an eating disorder to disordered eating, to chronic dieting, food anxiety, people who just want that better relationship with food. Because as I said, people move up and down that spectrum. It's very common. So I mentioned there that there isn't any specific criteria, but there are those overlaps and similarities with an eating disorder. So some of the risks and things I'll be talking about, some of that will apply to eating disorders as well. Although disordered eating tends to be less severe, it can still really have a big impact on quality of life. So it's still something that's really important and something that I believe really deserves attention and treatment as well. And in the same way that eating disorders are influenced by many different things, disordered eating is most likely influenced by a combination of biology and our genes and psychology and social factors and our environment. It's never just caused by one thing. It's quite a complex picture. And disordered eating is also much more common than clinical eating disorders. It's hard to get specific stats on it, with the definition being quite a grey area, but it is known to be much more common than eating disorders. And a really important point with both disordered eating and eating disorders is that early intervention and prevention are key. So actually catching it at the stage of disordered eating can potentially reduce the risk of it then developing into a full-blown eating disorder. So really as soon as possible, identifying it, getting the right support is known to be associated with the best recovery, the best outcomes in the longer term. And if we think about, we're going to talk about risks of eating disorders, but eating disorders can be absolutely lethal, can really ruin someone's life, can cause death ultimately. So it is actually a really important thing to be aware of, to try and catch that as early as possible. Okay, so I'll hand this over to you. I'd like to hear what you think. What is a healthy relationship with food? So if you put your thoughts there in the chat box, this is something I've already mentioned it a few times. I'm sure you've heard of this term. but what does it actually mean? Or are there any words or anything kind of coming up when you think about a healthy relationship with food? So I'm just keeping an eye on the chat box here. Can't see any answers coming through. I'm not sure if that's the tech side of things or if you're having a think. Oh, actually, they might be coming through the Q&A box. Let's see. Oh, chat is disabled. Okay, thank you for telling me. Okay, so Dara, I'm wondering, do you want me to do the interactive parts through the Q&A box, or will I skip over them?
Sorry, Maeve. Yeah, there's some stuff coming in from the Q&A box.
Yeah.
I can share them with you if you can't see.
Yeah, I can just see people saying the chat box is disabled.
Yeah. So one here from Philip is understanding the nutritional value of foods and the benefits of eating well.
Yeah.
We have another one here, which is, it means the ability to enjoy food. Yeah.
Some great answers there. And thanks for that, Dara. So I'll keep an eye on the Q&A, so I should be able to see kind of responses coming through there. So that enjoyment piece, that is so important. And also, understanding the nutritional values of food and benefits of eating well, as long as that's not, a fear-based or an obsessive type focus. So here are some words that, when I'm working with clients and based on my experience, are really associated with that healthy relationship with food. So it's a sustainable approach. It's something people can do for the rest of their lives. It's positive, satisfying. It's realistic as well. So rather than like a short-term faddy diet, it often incorporates mindfulness, mindful eating. The two words here in the middle, I think they're the two most important words when it comes to a healthy relationship with food, is that it's based around self-compassion and flexibility. And they're two just really key features of that good relationship with food. Enjoyable, as was mentioned, balance. I see that coming in on the chat box there, really tied in with variety. Social eating is a big part of a good relationship with food as well. Liberating, so it's that real kind of freedom side of things. And I see a message coming in here. So understanding the benefits of what you eat, but not punishing yourself when you might have kind of a bad day. So yeah, absolutely. The self-compassion rather than the punishing mindset. Thank you so much for sharing your thoughts on that. So what about then if we move on to talk about the risks? Can anyone think of any risks related to disordered eating? You could think about risks related to eating disorders either, because there is that crossover, as we said. Yeah, concentration, being obsessed with food, absolutely. Elimination of whole food groups. Yeah. Yeah, so that really kind of, restriction and cutting out whole food groups is a really key one. That's actually one of the red flags that we're going to talk about. Anxiety around social events, that's such an important one. One of our main domains of health is social health, and disordered eating can really impact social eating, which is such a big part of, why we eat. Impacting growth, body image, nutritional deficiencies, effect on sleep, mood. Yeah, absolutely. So you're painting a good picture here about all the different elements and when it comes to these risks. So I'm not going to go through each and every one here, but I'm going to highlight some key ones. And just to really say that as I'm going through some of these examples, they're touching on the three main domains of health. So the World Health Organization define health based on physical health, mental health, and social health. And an eating disorder or disordered eating can negatively impact all of those areas. So from the physical side of things, it can be muscle wasting, low energy, sleep was mentioned, gut issues, fertility issues, bone and heart health issues, of course, from the physical performance side of things, reduced performance, higher risk of injuries, the impact on body image, body dysmorphia, mental health, higher risk of self-harm. Overall, really, that reduced quality of life. And we also mentioned that social isolation. So you can see that it can really have this massive impact on so many different areas of health, well-being, and life in general. So I touched there on the effects in terms of performance. And what we really need to talk about here is relative energy deficiency in sport, or RED-S, or REDS, as some people call it. So I'm sure that a lot of you have heard of this already. And what this is impaired physiological functioning caused by relative energy deficiency that includes, but is not limited to, impairments on metabolic rate, menstrual function, bone health, immunity, protein synthesis, and cardiovascular health. So this is often discussed as low energy availability as well, or LEA, but really the kind of official term is RED-S. So when we dig into this, it can really RED-S, so not having enough energy. So expending too much energy compared to the energy that you are consuming, it can have this really, widespread effect in terms of physical health. We'd mentioned performance and injury risk, decreased training response as well, impaired judgment, decreased coordination. One of you had already mentioned as well, decreased concentration, irritability, depression around mood, decreased glycogen stores, and also decreased muscle strength. So you can see here how not having enough energy in the system, so really, not consuming enough calories and nutrients for the amount of exercise or movement that's being done, can be really, really harmful. And it's such a key one, obviously, for exercise professionals to be aware of. And actually, what I should say on this slide as well is that obviously this can occur in different situations. So this isn't always associated with disordered eating. Sometimes somebody just isn't aware of what they should be eating to fuel themselves properly, and they just need a bit of education and support. But there is quite an overlap with REDS and disordered eating, and also hypothalamic amenorrhea, where women lose their period as a side effect of this reduced energy availability. So it's just really important to know that there is quite a high link between disordered eating and REDS, but it isn't always the case. REDS can occur when somebody has a healthy relationship with food. Okay, so another question for you. Who's at risk of developing disordered eating? Is there anyone coming to mind? Maybe any type of client you've worked with, or any kind of group of people that you're aware of that are at risk of developing disordered eating? Oh, I see some answers coming through. So I see this a lot in females. Everyone given the right circumstances, but maybe overweight young people experiencing shame. 100%. You've hit the nail on the head there, that anybody can be at risk, but there are specific higher risk groups. Yeah, okay. So that's the key thing to take away from this slide, is that anyone can be at risk of disordered eating. So we don't just want to focus on high risk groups. We want to look for the red flags rather than, okay, this person does or does not seem to fit into the group of people that might be at risk. But then there are those that, we do have a higher risk. So those who have a family history of disordered eating or an eating disorder, those who have experienced significant trauma, teenagers, girls and women. So somebody had mentioned females, members of the LGBTQ plus community, those who have mental health issues or other medical conditions. So specifically PCOS, diabetes, autism and other forms of neurodivergence, OCD and disabilities. Those who experience weight stigma. So somebody had highlighted that as well. high achievers and perfectionists. So this is where, and I think Joe had mentioned this in the last talk that you had, actually those who seem the most motivated and, who really do their homework, who do what they're told, who seem to be, 100% all in, if they are more of that kind of high achiever, perfectionist type personality, and if they're displaying those behaviors as well when it comes to movement, then they can be, one of those groups that are particularly high risk of disordered eating. Athletes in particular as well, models, interestingly, nutrition and fitness professionals. So if anybody is watching this and if, red flags are coming up for yourself or for a colleague or anything like that, it's obviously really important to get that individual support as well. And a dieting history. So we'd mentioned even in the description of what is disordered eating, that history of dieting is definitely linked, and there's that crossover with disordered eating and dieting. So I want to give you some statistics here. So I'm going to read through these and just let me know if there's anything kind of surprising or anything that kind of hits you from these statistics. So 5% of people who diet will go on to experience disordered eating patterns, with 30 to 45% of those developing a full eating disorder. In a large study of 14 to 15-year-olds, dieting was the most important predictor of, sorry, I'm trying to move my picture out of the way here, of developing an eating disorder. Those who dieted moderately were 5 times more likely to develop an eating disorder, and those who practiced extreme restriction were 18 times more likely to develop an eating disorder. And then finally, less than 6% of those with eating disorders are medically diagnosed as underweight. So I'm wondering if that last statistic in particular is surprising to anyone, that less than 6% of people with eating disorders are diagnosed as underweight based on their BMI. I think that's a really important one to remember, because often when we think of eating disorders specifically, the image we have is someone who has anorexia and who's really emaciated and underweight, and that is a proportion of people, but it's actually a minority. So most people, they may seem like they have a healthy body weight, or they may actually have a bigger body and have an eating disorder. Okay, what about red flags? So can you think of any red flags for disordered eating? So if you were working with a client, or even if a friend or family member was talking to you, what might be some of the behaviors or some of the thoughts or things they're saying to you that might come up as, oh, that's a bit of a red flag, that they have a difficult relationship with food or a possible disordered relationship with food? Any thoughts there on the red flags? Oh, I see some coming through now. Calorie counting obsessively, absolutely. Cutting out food groups like carbs or dairy, 100%. Associating food with guilt or shame or as a reward. A reward for working out. Yes, that's such a good point that you've mentioned there. If it's that kind of reward or compensation, on the other hand, so if I can only eat a certain food if I've done a workout, or I can't eat breakfast until I've had a workout, or I can't go out for that meal at the weekend if I haven't done enough workouts during the week. It's that kind of compensation as well. Associating food, oh yeah, we've mentioned that one. And associating food with guilt or shame, absolutely, really common emotions when it comes to disordered eating. Overemphasis on eating or avoiding certain foods or food groups, absolutely. Yes, so cutting out food groups again. Refusal to attend social events. That's a really key one. As we said, that's one of the key areas of health. And if there's a lot of anxiety around food and they might feel like there's a lack of control there when it comes to social eating, then there can be just avoidance of that setting. People who can't have nice food in the house, can't have a portion of something without finishing the entire pack. So yeah, the kind of more binge eating side of things, absolutely. not eating around people, uncomfortable body language, eating socially, associating food with working out, running or walking to burn calories. Yes. Guilty eating, being anxious around eating, describing food as clean or good or bad. Yes, that is such a good one. So giving those labels, those black and white labels to food, like clean, good, bad, sin, naughty, treat, all of those things. Okay, so you've come up with some excellent red flags there. So there's a few more here. So a lot of you had already mentioned the restriction, low calorie side of things, and some of the specific signs of eating disorders like binging, anxiety, preoccupation with food. Some of the other ones to think about would be, of course, purging, so vomiting after eating. That compensation that we spoke about when, I can only eat this if I exercise, that's also a form of purging. Fasting or skipping meals. And especially now that fasting and like intermittent fasting in particular is so socially acceptable, but there's a really strong link between fasting and disordered eating. Cutting out food groups, a lot of you mentioned that one. That is a really important one to be aware of. Eating a lot of diet foods, so a lot of, low calorie, low fat, everything, lots of diet drinks, and like appetite suppressants, that kind of thing. Obsessively tracking as well, whether that's nutritional intake, movement, or both. Avoiding social eating. A few people had mentioned that one. Issues then with body image, body dysmorphia, body checking as well. So that's where people are often looking at their body and kind of pulling at their body. Self-worth based on weight or shape. That's a really a hallmark indicator of disordered eating. And then there's, some of the challenging things from a medical point of view, or things that can be really medically harmful. So the use of laxative, diuretics, steroids, or diet pills, missing or irregular periods as well. That can be a real sign. Obviously by itself, that isn't a sign of disordered eating, but in combination with some of these other red flags. Weakness, dizziness, always feeling cold, feeling sick a lot of the time, compensating for food with exercise, as we'd mentioned, and then some of those signs of reds like frequent injuries and reduced performance. And I wanted to highlight then some more specific diet ones. So some of these can be kind of related to fad diets, but a lot of the time that can cross over into a red flag for disordered eating. So having less than 1,800 calories, detoxing, so-called superfoods, cutting out food groups, so-called clean eating, cheat days. Again, that's that really kind of black and white way of looking at food. Specific, just obviously fatty diets like the carnivore diets, liquid diets, alkaline diets, appetite suppressants we'd mentioned, thinking of foods as good or bad, the IV vitamin drips, and without a medical reason, cutting out whole food groups, as you've highlighted. So that could be keto, it could be very low carb, gluten-free, dairy-free. So lots of different things there really to be aware of. But as you said, a lot of the time it comes back to that kind of obsession, the guilt, the shame, and cutting out whole food groups and being overly restrictive with food. Okay, so I wanted to spend some time here then talking about how to safely respond to suspected disordered eating. So there are 5 steps that I think are important for you as exercise professionals to think about. The first step, and if you just take away and really focus on one thing from this talk, then it really should be the first step, which is the awareness and the recognizing risks. So bringing it back to being familiar with what disordered eating is, who is at risk, but we know anyone really can be at risk, and the red flags. So really bringing it back to those red flags, going back to that slide, getting familiar with those things to look out for, and because that's the foundation of being able to respond to this in the most appropriate way. The second step then is, if you feel like you are noticing some of those red flags, is to express your concern or communicate or say what you have noticed. So thinking here, we've gone backwards or forwards. Expressing your concern then in terms of what you have noticed, which we're going to talk about in more detail. Signposting to appropriate support is the third step. The fourth step is then asking, is there anything that you can do, of course, within your scope of practice to support them? And of course, you're not expected to be therapists or dietitians. And then, do you need to report this to anyone or document it anywhere? So that's going to be really specific to the area that you work in. So there just might be a local policy or a line manager, or policies around confidentiality or medical conditions or eating disorders that you might need to kind of report this up the line. But that's going to be very specific to you and your job. Okay. So if we look here at the conversations around disordered eating, this is something that I think a lot of people feel understandably worried about, in terms of not wanting to say the wrong thing or not being comfortable approaching these type of conversations. But really, I think as exercise professionals, you play such an important role, because you build up such a strong relationship and such a strong rapport with the people you're working with. You're seeing each other very frequently, a lot more frequently than I would usually see my clients, for example. So you have quite an important role within their life. So if you are noticing something that you're worried about, building up that skill to feel confident to address it in a gentle way and signpost then to the right support is really invaluable for your clients. So what we want here is a caring, calm, supportive, non-judgmental approach and setting. We need to be prepared that there is likely to be some defensiveness. So it depends how aware somebody is of their issues with food or how sensitive they are about that. But it is likely that possibly in that first conversation in particular, there may be some defensiveness. It's best if we use I statements so that it's less accusatory. So I statements will be things like, I've been noticing X, I've been feeling concerned about your relationship with food from what you've been telling me. I've seen you body checking a lot during our classes. So just bringing it back to I, rather than saying, you need to fix your relationship with food or you have disordered eating or something like that. It's more just taking it back to, okay, this is what I've noticed. This is how I feel. And it's also important to consider then actually who is the best person to have that conversation with the person. So based on who has the best relationship and rapport with the client, and also who has some knowledge of disordered eating and feels comfortable in having that conversation. And if the client is under 18, it's important to think about who will speak to their family then as well, or what's going to be happening in terms of consent and their capacity as well. So if you do work with young people, there should be a specific policy in place related to your workplace, which will give you some more specifics on that. And again, you should have somebody to support you with that. Also important to choose a time and place that's likely to feel comfortable and safe to the person that you're speaking to. And, you're not aiming to fix anything then and there. It's really just about expressing that concern. And if they're in the right headspace, to signpost them to support, or even just maybe if they're not really open to that support at that stage, that they know that they can come to you for that signposting, that you have some places that you can send them, some links and things of some of the support services we're going to talk about to help them. So then moving on to that signposting, there's two main things that you need to think about here. So the first line is speaking to their GP and tapping into their support network. So that could be friends, family, can be online support groups like the eating disorder charity Bodywise. And I've provided you links for different online support groups at the end of this talk. So that can be the place to start for a lot of people. In terms of the GP, that can sometimes depend on the severity. So if you're seeing physical signs of disordered eating, if it seems to be having quite a big impact, if it seems severe, really important to speak to the GP. If it's more somebody is quite physically healthy, but there are some concerns, or maybe they just want to become more of an intuitive eater, say, for example, they may not always feel they need to speak to their GP in that instance, but if in doubt, it's a really good place to start, is speaking to the GP. And then in terms of that kind of ideal scenario for disordered eating recovery, it's getting support from a medical professional, a nutrition professional, and a mental health professional, all of which should have appropriate training and experience with disordered eating. But again, that will depend on severity. So if it was an actual clinical eating disorder, those three should definitely be in place. If it's less severe, it may not always be necessary to have all of those three things happening at once, but the individual professionals will be able to advise on that as well. So even if somebody tapped into one of those, medical, nutritional, or mental health, then they'll be able to let them know that actually I feel that you should be informing your GP about this, or I feel, if I'm on a discovery call with somebody and it's clear that psychological support is going to be necessary as well, of course, I'll always let them know. So really, if they tap into any of those three professionals, that can be a really positive step in terms of recovery. And I just want to highlight here as well that sometimes private services are needed when it comes to disordered eating. Again, if we bring it back to the criteria, so eating disorder services are based on that criteria. So somebody with disordered eating often won't meet that criteria. And even if they do meet the criteria, the waiting lists can be extremely long. So it's really unfortunate that that is the case, but that is where kind of private services can fill a gap as well. Okay, so when we're thinking about this, and we're thinking about particularly the fourth point that I mentioned about asking, is there anything that I can do within my scope to support you? We need to think about, well, what is your scope of practice, or what are your boundaries? So as I've been going through that, is anything coming up for you that you can see, like, that's where my line is, that's my scope of practice, or that certain thing would be beyond my scope of practice? What might your boundaries be? Or are there any questions coming up for you about, well, what is my scope of practice? So what if somebody starts to talk to you about mental health? Okay, good question. And I guess that could go for anything, couldn't it? It could go for, what if they start to talk to you about the intricacies of nutrition or something as well. So that's where, when we're working with people, being able to listen and validate is important, but just being very clear to them that, I'm not a mental health professional, I'm not a nutrition professional, so I can't give you any advice on this. I can listen to you and I can signpost you in the right direction, but I'm not the person to be giving you specific advice when it comes to mental health, say. That's a good example. So some thoughts that I would have here is, as I've already mentioned, is that you're not expected, or it's not advised for you to take on the role of therapist or dietitian. But there are some other things that I do think really do fall into the scope of practice of a registered exercise professional. So I know that as a registered exercise professional, it is within your remit to talk about the HSE healthy eating guidelines. So it's really important for me to highlight here that those guidelines aren't appropriate for those who have a disordered relationship with food or an eating disorder. Basically, there is a bit of kind of over restriction in terms of the higher fat foods, and there is like the portions and the serving sizes and the recommended amounts of what I would call soul foods, what they would call the top shelf of the food pyramid, the foods higher in fat, salt, and sugar. So that advice isn't appropriate for someone with disordered eating. So really what I would say to you there is not to talk about food and nutrition with those who either have disordered eating and eating disorder, or you might suspect that they do. So because really that's where the specialized support would be needed. It would be the same thing if somebody had liver disease or diabetes or cancer, and the type of nutrition advice is going to be different for them. It's not going to be the blanket healthy eating advice. So that's just something really important to highlight there. So where I think is really important for exercise professionals to think about is role modeling. So, and that can come into a lot of different aspects in terms of like language and the environment, which I'm going to talk about. But really, role modeling a healthy relationship with food and exercise yourself. So not using lots of, diety language, not overly focusing on image and appearance, and focusing on exercise, in a healthy way for enjoyment rather than an obsessive or compulsive way. So I think, and I'm sure a lot of you are obviously doing that already. So that role modeling in itself is really, really helpful for those who have a disordered relationship with food. And language is a particularly important one. And we're going to go through some examples related to that when we talk about diet culture. Also the fitness environment. So, are there before and after pictures on the walls? Are there quotes about, getting a beach body or something like that? So all these things that can be really triggering, either to those who already have a difficult relationship with food or can kind of contribute to developing issues with food, body image, and movement. And if you need any kind of individual support around defining your goals, because it will be specific to the area you work in, your experience, your training, then, it might be worth speaking to somebody specifically in your industry related to that. But some of the thoughts that I would have would be thinking about the client's goals and possibly adapting their training plan. So a lot of the time when somebody is in recovery for disordered eating, that movement might need to reduce, especially if there's a compulsive element there. So it could be more focusing on gentle movement, on rest, on flexibility. And that might be including working with the MDT, so the multidisciplinary team, like their doctor and dietitian. If it's agreed that, okay, maybe they need actually a specific break from exercise or a specific reduction. And sometimes even ending input if it seemed unsafe, if this seemed to be like an exercise addiction, for example. Okay, so this is a case study then to kind of bring it together in terms of, what would you do if you're suspecting disordered eating? So this is Sandra. She is the 34-year-old woman who is taking part in a group fitness class, and she doesn't have any specific medical diagnosis. But over the weeks that you're working with her, you start to notice her preoccupation with losing weight, lots of diet chat, including that she's now allowed to have breakfast because she exercised, looking at her body a lot in the mirror during classes, never accepting invites to brunch by other members of the group, becoming weak and fatigued during classes, even dizzy on occasion. And then she comes up to you and she asks your advice about whether missing a period can be linked to exercise. So what red flags are you noticing there with Sandra? You may or may not have already worked with somebody similar, or you may have seen some of these red flags already. So there's quite a few in there to choose from. Is there anything there that might be worrying? Combination of all. Yes, very good point. That some of these things in isolation might not be a concern, but actually there's quite a few different red flags there. Pretty much all are red flags. Yeah, absolutely. So yeah, preoccupation with losing weight, diet chat, body checking, social isolation, avoiding social eating, the physical signs there of being malnourished, and missing a period. So yeah, absolutely, all red flags. So how could you respond to this safely? What might be the first thing you think about doing? start with, I've noticed that you, yes, absolutely. And that's actually just a really good sentence to have in your mind for, for different discussions and things as well, is say what you see. I've noticed X, I've noticed that you've been, checking your body a lot during the class, and that you seem to be concerned about what you're eating. Just mentioning the things that are coming up and kind of see how that conversation goes. Ask whether she is concerned. That's a really good point. Yeah. So asking her opinion on it, I've noticed this, but how do you feel about it? Do you feel concerned? In a confidential area after class, pick the place carefully. Yes, really good point. So it's not just, chatting in front of the rest of the class. It's picking the time and the place. So you've mentioned some really good points there in terms of expressing your concern, which is that place to start, as we mentioned. Okay, how might you respond if she becomes very defensive? Do you withdraw? Yeah, so if somebody was to become very defensive, then they're not in the place to listen. So we don't want to, you don't respond to fire with fire. So basically it would be, even again, kind of saying what you're seeing. It could be, I'm noticing that this is seeming like a difficult conversation for you, or maybe this isn't the time to have this conversation, or, we can leave it there for today. I just really wanted to express my concern, and just know that you can talk to me if you feel like you ever want to be signposted. So yeah, there's no point pushing it further, but just really still expressing that concern and care, and knowing that she can come back to you, because a lot of the time it's about planting a seed, and just so somebody knows they can talk to you if needed. Because it might be then that she goes home and talks to her partner or somebody else. Maybe she's just not comfortable in that environment speaking about it or speaking to you, but she may be comfortable speaking to somebody else. So, you can still have really done a beneficial thing by planting that seed, even if there's never any more discussions about it. That was a good question. Okay, just in terms of time, I'm going to move on now to think about the preventative side of things. So what is diet culture? I'm sure you've all heard this term, diet culture, but a lot of the time we don't really get a definition of, what actually is that. So diet culture is the culture surrounding dieting and the pursuit of weight loss, which places the thin ideal above health and inclusivity. So the thin ideal is this idea that, the best thing is to be thin. And it also leads to weight stigma and fat phobia. So we see diet culture everywhere. I'm sure you're all very familiar with it. We see it in magazines, of course, on social media, conversations with friends and family, even, having calories plastered over menus as they do in the UK at the moment. And having sign, guilt-free written on a label. These are all signs of diet culture that are centering the pursuit of weight loss. In a gym setting, this might be things like before and after photos, weight loss challenges, certain diety messages on the wall. It could be diet tools. So sometimes nutrition and movement trackers can be part of that. It does depend how they're used, of course, or like really prominent weighing scales or practices of, weighing everyone routinely. And this was an interesting study that I want to share with you. And this was in Northwestern University, and they had fitness instructors, and they split the group in two. So they had the same workout, the same music. It was like a 16-minute workout. But the first instructor was given a script that was linked with positive body image and saying things like, oh, this workout, it's going to make you really strong. It's going to make you feel great. And the second group had an instructor who was saying things like, let's get rid of that cellulite. Let's burn that fat. Let's get rid of those thunder thighs. And what they found was the first group had significantly better feelings of body image and feeling accomplished, feeling good, whereas the second group felt that shame and disgust. So just a bit of evidence really to back up the importance of that environment and, the language as well that's being used. So in terms of language, so I'd like you to have a think here about how could you say these things or change them to be either more positive, more neutral, less diety. So you don't need to do each and every one, but if you even pick one or two of them and then just put in the chat what number it is and what you could change that word to, what would be more inclusive and better, particularly for somebody who has disordered eating? What terms might be better for them to hear? So I'm sure a lot of you, probably don't use a lot of these terms anyway. I've kind of gone for the kind of cliche and like extreme examples. So you can even pick one of them and just think what term might be more neutral and more positive. Junk food equals occasional food. Interesting. And I'll give you my take on these now in the next slide once we get a few more examples through. So yeah, that junk food equals occasional food. That could be an option. It's definitely a gentler version, but there's still a diety connotation there, that it's kind of occasional. It's still fitting into that category. Okay, just in the interest of time, actually, I'm going to go on to show you these examples. So the first one I thought was really important to include. So overweight or obese, it may be that you just don't need to use any term, you don't need to go there at all. But this can be really specific to individuals. My go-to, because we know that overweight and obesity, those words are really stigmatizing and people really experience them as stigmatizing. So the best thing to do is to ask the person if you would need to use that descriptor. My go-to would tend to be bigger body, but some people who are involved in kind of fat liberation, they reclaim the word fat in the same way that the word queer has been reclaimed. So some people just see fat as a neutral descriptor, the same way like thin would be, but obviously not everybody sees it that way. So I'm still a bit careful about the use of that word, and I would tend to go bigger body. Exercise, of course, isn't always a negative at all, but if somebody has a bad relationship with movement, then exercise, they may think of that as being kind of strict, no pain, no gain, quite a rigid form of movement. Whereas movement can be a more gentle way of phrasing that, because movement obviously incorporates all activities of daily life as well. When it comes to treat, junk food, sin, cheat meal, all of these things, I would just really bring it back to neutral. So just food, it's just food. Or you can call it by its name. So instead of treat, it's cake or it's biscuit. Just being really neutral about those. And I think treat in particular is one that it's a lot of us struggle to unlearn. It's just really ingrained in us to use that word, but that word actually really does put certain foods on a pedestal rather than keeping everything just a more neutral playing field. Beach body, just body. Of course, anyone with a body has a beach body. Ripped or shredded. So instead of focusing on aesthetics, it could be strong, healthy. Time to earn your dinner. It could be, you're one step closer to your goals. Burning off the weekend takeaway. I hope you enjoy this workout, focusing on the enjoyment side of things. Time to burn some fat, time to get stronger and feel good. So just to quickly touch on weight bias and weight stigma, because I've mentioned this already. This is the negative actions, beliefs, and stereotypes or attitudes about others because of their weight. And this really ties in with fat phobia, which is the irrational fear, aversion, or discrimination against people in bigger bodies. So this is a really serious issue. And just even the society that we live in, we've all been impacted by weight bias or weight stigma. And, most of us will have some internalized weight bias, weight stigma. Doesn't make us bad people, but it's just something to be aware of and to work on and to unlearn if that's something that aligns with your values. Oh, sorry, I've gone forward. And it's one of the reasons for this is that experiencing weight stigma has been linked with increased health issues such as diabetes and actually paradoxically having a higher weight as well. And that was true in studies where, people who have the same higher BMI, the group that have experienced weight stigma had experienced things like a higher risk of diabetes compared to those who didn't. So that wasn't just a backwards cause and effect link. increased stress as well, including markers of inflammation and stress hormones, disordered eating, body image issues, depression, anxiety, reduced self-esteem, and avoidance of healthcare settings. So this is really where non-diet or anti-diet approaches come in. They are, I guess, like the antidote to diet culture. They're based on a do no harm approach. And in this approach, health is not defined by weight. So this is a newer approach because traditionally, in terms of kind of the health and medicine, there's been a real emphasis on weight, and it's really been put in the center of health. This zooms out and looks at the big complex picture of health and everything else that's involved and doesn't put weight in the center. It also prioritizes reducing weight stigma and making healthcare more inclusive. So this doesn't mean that weight has no impact on health or well-being, but it acknowledges the risks and issues related to pursuing weight loss, which I'll mention quite soon. And there are lots of different names and terms when it comes to this. You know, I tend to use weight inclusive, size inclusive is similar, intuitive eating, intuitive movement, health at every size. They're all kind of under the umbrella of non-diet or anti-diet approaches. So in terms of the evidence, this is, of course, a newer approach, as I've said, but there is mounting evidence as well. So a really interesting one, I think, and very relevant to fitness professionals is that fitness has been seen to be a stronger predictor of mortality than BMI or weight. So I think that's a really important message and a great thing to highlight to people. And also then, regardless of weight, it's actually the health behaviors that make the difference. So, you know, the benefits of movement, the benefits of stress management and sleep and nutritious eating, regardless of what is happening to weight. And sometimes weight will change as a result of that, but not always. And then weight inclusive approaches have also been linked with improvements in health behaviors, blood pressure, cholesterol, body image, mental health, weight stability, relationship with food, and we get lower dropout rates in weight inclusive studies as well compared to weight loss studies. And intuitive eating is one of the most well-known and most common non-diet approaches. And we actually now have more than 175 studies showing us that intuitive eating is linked with less disordered eating and higher levels of self-esteem, better body image as well. And we also then have the evidence related to diets that, you know, goes back much further than the evidence we have related to non-diet approaches. You know, evidence showing that trying to lose weight is associated with a higher risk of disordered eating, body image issues, mental health issues, weight cycling, reduced health behaviors, weight loss studies not accounting for weight stigma or disordered eating. I mentioned the high dropout rates and the fact that in weight loss studies, so less than half of participants lose 5% of their body weight, and most people that lose it then regain it, and sometimes more within 5 years. And the biggest loser study is the longest study really that we have looking at this, which was a 6-year follow-up. And they found that extreme weight loss in particular, based on the Biggest Loser TV show in America, was linked with metabolic adaptation, which was a reduction in metabolism more than you would expect, just based on the fact that these people now had smaller bodies. So 500 calories less than you would expect. Also reductions in fullness hormones. You know, most people regained and also then reported disordered habits, including compulsive exercise. So in terms of some of the non-weight related benefits of movement, I'm sure you all have a really good grasp of this, so I won't go on about this for too long. Just to say that there are so many benefits of movement that aren't related to weight. And again, I think this is just a key message for all healthcare professionals to be encouraging, but particularly, of course, then for exercise professionals. Because if somebody is having a difficult relationship with their body, with food, with movement, focusing on these kind of non-weight related things can be a really helpful shift in their focus and can be just much healthier for them. Also just wanted to highlight, you know, some of the great non-diet fitness professionals that are out there. Of course, there's plenty more. And I have to say, I'm hearing more and more positive things from clients as well with the professionals they're working with, whether they're specifically non-diet or not, about, you know, being really supportive. And especially when my clients come to them and say, you know, please don't weigh me, please don't focus on weight loss. I want to focus on strength and flexibility. People just being really supportive and helpful. And I think there's a real opportunity for non-diet fitness professionals, because I know that, a lot of people I work with and a lot of people who speak to me on social media are looking for non-diet PTs and professionals. So yeah, I think it's actually a really exciting area for non-diet fitness professionals. And I do want to mention that, of course, if there's some resistance coming up to this, that's very normal, very understandable. Most of us haven't been trained in this way. This is kind of a newer way of looking at things. And it can take time, if this is something that's of interest to you, it can take time to unpack that and to kind of unlearn and relearn a different way of doing things. Okay, so to make sure we can get through some questions, and to summarize there, really important to be aware of those disordered eating red flags. So if there's one thing you take away from this, is to go back and look at those red flags, get familiar with those. And then the next step is expressing your concern and signposting as needed. Being aware that with clients who have disordered eating, the goals may shift to more of gentle movement, possibly rest, possibly flexibility focus, and avoiding any healthy eating advice. And then to reduce the risk of actually contributing to disordered eating, focusing on the many non-weight related benefits of movement, being careful with language, making the physical environment inclusive as well. And again, for anybody who is interested in the more non-diet approach, just to really reiterate that it takes time, practice, and unlearning. I found it to be really rewarding and a great direction to move in. And I really do think things are going in that direction. But as I said, it's very normal if there's kind of questions, uncertainties, and resistance related to that as well. So I've included some resources here related to eating disorders in sports, Bodywise charity in Ireland, Eating Disorder Charity. I've included the UK one as well. 2 of my blog posts about weight inclusive versus kind of weight centric care. I have a slide here on signposting resources as well to different helplines, finding dietitians and counsellors. I've included the UK and Ireland just because a lot of people are working online now to give a bigger pool of options. And there is my website and social media and my clinic email if anybody would like to get in touch or signpost on. So thank you so much for listening. I think we've gone just about to an hour now, but I'd be very happy to answer questions that you might have.
Maeve, thank you very much. That was brilliant. I know myself, I was sitting here with a pen and a piece of paper and taking as many notes as I could. So I hope everyone on the call was also. I'm conscious a couple of people might have questions around some of the stuff that you brought up. So we might give them a minute or two just to get their questions in. But I know I'd certainly like to start with a question if that's okay.
Of course, yeah.
I was really, really interested to learn kind of about that, the language element and the compassion to show to members and like our exercise professionals who are on the call today, some of their clients and things like that. And also just in terms of that language and the goal setting, you had some great examples there. But for our members who are on the call today who might have clients who they are coming and they are very obsessive with, that weight loss element, like I'm coming to you for the weight loss element. I'm coming to you because, I want to get rid of the love handles people say when they're coming to our exercise professionals. How can our professionals, I suppose, change those goals with their clients to kind of encourage that element where it's not weight loss and we're using exercise from a health perspective and movement the way you were talking?
Yeah, great question. This is something I think is going to come up a lot. So really there's 2 ways of approaching it. So, and it depends where you work and what control you have over that as well. So if you're working for a specific company, that does provide weight loss as a service, then you may not be able to totally move away from weight loss, even if you wanted to. Or if you do, have the freedom to decide what way you work totally, then you can decide that I just don't advertise weight loss. I don't advise it. I'm quite clear and upfront about that. It's just not part of my service, in the way that somebody might not be specialized in exercise for cardiac rehab or, other areas. So I guess that's the more clear-cut answer. And in that instance, you could call yourself anti-diet if you're not focusing on weight loss. The second approach is more the kind of middle ground, where it wouldn't be accurate to call yourself non-diet and still offer weight loss, but you could still bring in a lot of the positives that I've mentioned. So basically, you can still yourself, look at the environment, look at those posters on the wall, and not have standard weigh-ins unless you have to as part of your job. You can, kind of acknowledge that's what somebody wants, but also say, dig in a little deeper. Is there anything else? If you look at like what makes you happy, your quality of life, is there anything else here that might be a benefit? Go through some of those non-weight related ones to see. So even if they do have a goal of weight loss, which is valid, that can be their choice. Even trying to add in another goal or two that isn't related to weight loss. So any sort of extra step in that direction, I think can be really positive.
Yeah, no, that's brilliant. And I know there is, I suppose, a lot of pressure out there on people, especially when we look at Instagram and you're seeing nowadays, it's all about the kind of, I suppose, the hustle. How much more can you do? Get to the gym at 6 a.m. But also, you've got to be recovering enough. And there is that element where some people are going to struggle with the pressure that's being placed on them to do all these things. And I suppose how that impacts them. But one thing I would like to get your opinion on is, I suppose, intermittent fasting has become such a big thing. And I suppose just to hear your view on it.
Yeah, great question. So intermittent fasting, is definitely really popular. And for some people, it works really well. What I would really highlight is that in terms of the evidence base, so there's emerging evidence related to the benefits for people with diabetes or who are at risk of type 2 diabetes. But it's more related to the timing of the meals. So basically eating more in the earlier part of the day, syncing up with your body clock. It's looking like that may be beneficial. And one study found that was the case, even when weight didn't change. So I guess intermittent fasting in itself isn't always about weight anyway. But really a lot of the research has been done in labs, in animals, in men. So applying it to women in particular, there's a lot of unknowns. And because female hormones are so sensitive to energy availability, it can often be quite risky. Like it will really increase the risk of somebody losing their period, for example, if they're active, especially if they're not, fueling up well enough for movement or recovering properly. And there is an overlap with intermittent fasting and fasting in general and eating disorders, disordered eating. There hasn't been loads of studies. There's only really been about 3 studies in intermittent fasting and disordered eating, but it has been linked with increased risk of bulimia and binge eating disorder.
No, brilliant. And it's great just to see here in the Q&A section that I'm seeing now, that language piece that you touched on and the images on the walls and things like that has been flagged now to a couple of the professionals on the call here. So I'm just conscious of time, and I suppose just to maybe wrap up just with one more question, I suppose, is it always unhealthy to cut out a food group? So naturally, I know you've spoken about it's kind of relearning some of the things that we've been told over the years, and there is an emphasis on always cutting out things from a diet. So is it unhealthy?
That's a great question, because I know I had mentioned that as a red flag, basically, that cutting out a food group is a red flag to look out for. It's more about what's behind it. So what's the motivation? So I guess if we take like veganism as a current really popular example, common motivations for veganism, some people it's kind of health related or weight loss related. It's environment for some people, it's animal welfare, it's kind of just food preference for some people. So if it's all about kind of health or weight loss, then that would be more of a red flag for me. If it's genuinely about, the environment and animal welfare, and also if it's done in a flexible way where, okay, you're vegan, so chips are vegan, sugar is vegan. But if people are vegan and then only eating like veg and, having a really restricted diet in that way, then again, that will be more of a red flag. So it does really depend on what is that motivation, and is there flexibility within that as well, or is that just like a really rigid restriction?
Yeah, no, I think that's a massive piece from what I've taken today anyway, is that compassion and flexibility within a diet as well, to allow people to enjoy their life, which is the most important thing.
100%, yeah.
Just one last question then, Maeve, that I see coming into the Q&A. It's, are there any courses that are available to fitness professionals to focus more on anti-diet?
That's a great question. So the London Centre for Intuitive Eating, which has recently changed over, they do a course on like an introduction to intuitive eating, which is kind of quite anti-diet, but it is specifically around intuitive eating. So it's called, I'm trying to think what it's called now. It's called Learn with LCIE. So that is, it's mainly tailored towards nutrition professionals, but it is open to, you know, other kinds of professionals as well. And they do mention fitness professionals within the course as well. So that's the one that I'm most aware of. I don't know if Tally Rye does anything. She'd be the most prominent person in the anti-diet movement space. Definitely would recommend her book, particularly her first book, and her podcast. And she might be someone to reach out to on social media who might know if there's any good courses related to that. Or it could be a bit of a niche in the market.
No, brilliant. And Maeve, I'm conscious of your time and I'm conscious of everyone's time who's on the call here today. So we'll just start to wrap up. Thank you very much for the webinar here today. We've taken plenty of things from this webinar. I would suggest that everyone goes and visits Maeve's website. I know you have a lot of blogs, posts up there, which are excellent, and there's plenty of learning points to take away. I'd also like to just thank the National Dairy Council again for allowing us to provide these webinars to our members. It's excellent to be able to do these things and provide this service to our members. So thanks a million for attending today, folks. Maeve, thanks a million for your time. It was brilliant. I'll be sure to link the recording in the next email to all our members. So thank you very much and have a great rest of your day. Thank you.
Thank you so much.